So I'm going to talk to you about a condition called angiomyolipoma, or AML.
Angiomyolipomas became famous recently when the first lady underwent this procedure.
Tara, I think most people hadn't even heard of this procedure until yesterday. So what is it exactly and how do you discover it?
These are totally benign kidney tumors, but they can cause problems, especially if they grow large. They tend to have a lot of blood flow and big vessels running through them. So when they get more than about 4 centimeters, they have a risk of internal bleeding. Spontaneously, they can just rupture one of these blood vessels and start bleeding, which can be a problem. It can cause a lot of pain. It can drop your blood pressure. In some situations, people can get very sick. So sometimes when that happens, patients could require to have an emergency kidney removal. The good news is that we have effective treatments to manage them with minimal side effects. And one of the most successful options, it's called an angiomyolipoma embolization. So you see, in the past, people used to do major surgery to remove these tumors, which could require big incisions, potentially bleeding during the surgery, and a long recovery time. But today, this is not the case anymore. One of the most effective treatments, like I said, is the embolization. So what is an embolization? Embolization is a minimally invasive procedure that allows to block the blood supply to the tumor. By doing this, we can shrink it and prevent from bleeding in the future.
So this is a picture of a kidney with a tumor in it. In this procedure, we introduce a tiny catheter and navigate under X-rays to the blood vessel going to the tumor so we can block the blood flow and the nutrients to make the tumor shrink.
So how do we do this? The procedure is done by an interventional radiologist like me, using specialized imaging techniques and expensive equipment to basically guide a tiny catheter into the blood supply going to these tumors. So once we put the catheter in the specific artery that is going to the tumor and not going anywhere else, especially to the normal kidney, basically destroy the tiny blood vessels inside the tumor. And there are a couple of different options that we can use.
We inject in the tumors is a solution called lipiodol combined with 99% ethanol,
which is very toxic to the blood vessels and will destroy them. But it's very targeted and will just destroy the tumor, but nothing else.
So this is the angiogram. That's when you put a catheter and inject dye directly into the artery going to the kidney, showing the angiomyolipoma. We then insert the microcatheter, which is a tiny catheter that goes all the way in the artery, feeding the angiomyolipoma. And these are the vessels of the benign tumor that usually cause bleeding. This is another picture showing the high vascularity of these tumors and the tumor blush. This is when we're injecting the ethanol, which is alcohol, to kill the tumor from the inside. And this is the final image, which shows the kidney taking up the contrast, but the tumor is completely dead.
So what to expect after the procedure? Embolization is very safe, effective, and minimally invasive. So most patients do these procedures with a mild sedation. They don't require general anesthesia. So the recovery is very fast. The entire procedure usually takes about half an hour, and most people go home the same day. After the procedure, some patients can develop some discomfort in the flank, in the area that we treated, obviously, but usually it's just for a few days. I've had some patients had some fever afterwards, usually from the body fighting the dead tumor, but that also resolved in a few days and responds really well to ibuprofen or Tylenol and things like that. Overall, if you do have an angiomyolipoma that's growing or it's big, I think the embolization may be a great option for you. It's much easier than the surgery and overall very successful with over 90% of the patients not requiring anything else. To sum up, embolization is a great option for treating angiomyolipomas, especially those that are more than 4 centimeters, which increases significantly the risk of bleeding. It is safe and effective and with minimal recovery time.